Hello, this is Dr. Ford Brewer with state-of-the-art preventive medicine, heart attack, stroke, and cancer prevention. Available to anyone with YouTube access. Today we're talking about Livalo, or Pitavastatin, versus Crestor, or Rosuvastatin. Pitavastatin has come about recently. It was used a lot in Japan before it was used here, and it's becoming very popular. Here's some reasons why. Like other statins, it's an inhibitor of HMG-CoA reductase. Again, pardon the technical terms. It's an enzyme that catalyzes the first step of cholesterol synthesis. So it inhibits cholesterol synthesis by inhibiting the enzyme that creates it. It's been shown to increase HDL, the good cholesterol, especially if that value is lower than 40. That lower than 40 value of HDL is what classically happens with diabetes and insulin resistance. So what else does it do? It lowers LDL mostly better than other statins at comparable doses. So another very positive thing about Livalo. There is even evidence that it lowers the average glucose, at least as measured by hemoglobin A1C. So again, you begin to see why this is becoming popular very quickly. I've had several patients ask me about it. But I haven't even mentioned the thing that was the most beneficial about this statin. Livalo, or Pitavastatin, has been shown to have decreased side effects, especially the muscle-related side effects. So what's not to like about Pitavastatin or Livalo? And why don't I use it? Why do I use Crestor mostly? Well, here's why. It's not the cost. Yes, Livalo is newer and more expensive, but my patients are not that price sensitive. It's the indication and the logic of the medicine. I'm not treating and preventing increase of LDL usually in my patients. I'm not treating their diabetes with a statin either. My major priority with my patients is to decrease and prevent their cardiovascular inflammation. Livalo, Pitavastatin, has not been shown to have any impact on cardiovascular inflammation. So, if your indication is cardiovascular inflammation, then Livalo's not going to enter the decision calculus. There's another thing too, especially for those majority of us that are getting this kind of care that have insulin resistance or diabetes. Doesn't Crestor increase diabetes or push us down that diabetic highway? Yes, but only at the higher doses. The lower doses of Crestor have a positive impact on inflammation, cardiovascular inflammation, and zero impact on pushing us down the diabetic highway. So again, if the indication is to decrease or prevent cardiovascular inflammation, then Crestor or Rosuvastatin in a low dose is the choice. Livalo would be a great choice if your major focus were decreasing LDL, or maybe a combination of decreased LDL and HDL, and maybe a combination of those two plus diabetes. But again, we usually tend to use other drugs for those issues, and we usually focus on the priority, the thing that causes the heart attack and stroke: cardiovascular inflammation. Thank you.